So one of the things that I've talked about is using physical therapy to help treat both urge and stress incontinence. And physical therapy can be done at the home setting and can be as easy as doing Kegel exercises. That is, squeezing when you're trying to stop the flow of urine, or like you're trying to stop the flow of urine, but not while you're urinating, because we don't want to cause a bladder infection. So what I typically recommend is doing that every time you see a red stoplight or every time a commercial comes on the TV. You squeeze and hold for 10 seconds. One option is to see a female health physical therapist. They are physical therapists who help teach you how to do those Kegels, who may use weights or biofeedback, which measures how strong you squeeze, or electrical stimulation to help you learn how to do those Kegel exercises better. Some people are not comfortable seeing a physical therapist in a clinical setting. It's awkward, there may be other people around, etc. And for those, there are home physical therapy devices that may help. One is a device called Intone. Intone is a device that goes into the vagina and you inflate it slightly. When you inflate it to a set pressure, which is defined in our office, that you can then reproduce at home. And then you squeeze against that pressure and it talks you through it. It takes about 10 to 12 minutes, and typically it's done every day for 6 days, 1 day off for 12 weeks, and then 1 to 3 days after that. I use analogies sort of like training for the marathon. You have to train hard to be able to run a marathon, but once you can run a marathon, it takes less effort to maintain that level of conditioning. The device is a little big. It's a little scary. Might look like what you might picture it to look like, but it looks like this. And it does not go all the way in the body. It goes in to approximately here. And then you inflate it, and it measures how hard you squeeze. It also has two paddles, one on the front and one on the back, that measure that can electrically stimulate the bladder to help with you contract muscles you didn't know you had. It has a high success rate for stress incontinence, as high as 90%. And actually, it's one of the few companies that offers a money-back guarantee on their treatment. Not truly money back because you get about all but about $100 back, but it's a great option. Unfortunately, not well covered by insurance. Interestingly, because of the electrical stimulation, much like much like the interstim or the posterior tibial nerve stimulation, the, the neuromodulation of the bladder from that electrical energy may help with urgency. And so it also may help with urge incontinence. Lastly, because you're strengthening the pelvic floor and contracting muscles you didn't know you had, it may also help with pelvic floor prolapse.